Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Acoustic neuroma. Introduction. Acoustic neuroma is a non-cancerous tumor that develops in the nerve that connects the ear to the brain. It is also known as a vestibular-schwannoma. Depending on the age of the patient and the size of the tumor, treatment may be needed. If the tumor grows large enough, it can press against the brain and become life-threatening. This program explains what acoustic neuroma is and what causes it. It also covers symptoms, diagnosis, and treatment. The ear. Our ears are very specialized organs that allow us to hear and keep our balance. The ear has three parts. 1. The outer ear, which includes the auricle and the ear canal. The ear canal goes inside the ear to the tympanic membrane. 2. The middle ear, which is made of three small bones called the ossicles. 3. The inner ear. The auricle acts like a satellite dish that collects sound waves, which are vibrations in the air. Sound waves enter the ear canal and cause the eardrum to vibrate. When the eardrum or tympanic membrane vibrates, the three small bones of the middle ear also vibrate and send the vibration to the inner ear. Vibrations sent to the inner ear are relayed to an organ inside the inner ear called the cochlea. The cochlea has a snail-like shape. Inside of it, vibrations are changed into electrical signals. A nerve called the eighth nerve carries the electrical signals to the brain, which understands them as sounds. The eighth nerve is also known as the vestibulocochlear nerve. It is this nerve that is affected by acoustic neuroma. A section of the inner ear, as well as the eighth nerve, are responsible for aspects of balance. This is why many times hearing problems and balance problems happen at the same time. Tumor versus cancer. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way, causing an abnormal growth called a tumor. If the tumor invades nearby tissues and body parts, it is called a malignant tumor, or cancer. Cancerous cells spread to different parts of the body through blood vessels and lymph channels. Cancer that moves from one tissue to other body parts is known as metastatic cancer. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor or non-cancerous growth. Acoustic neuroma is a benign tumor. Benign tumors are usually not life-threatening. However, an acoustic neuroma can become life-threatening if it grows large enough. A large acoustic neuroma may press on the brain and possibly result in death. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms of acoustic neuroma. At first, you may have no symptoms or mild symptoms. Symptoms appear as the tumor grows and presses on nearby nerves, blood vessels, or structures of the brain. Larger tumors are more likely to cause symptoms. However, it is possible for small tumors to cause severe symptoms. It depends on where exactly the tumor is located. Symptoms of acoustic neuroma are similar to those of middle ear problems. Common symptoms include loss of hearing on one side, ringing in the ears, dizziness and balance problems. The tumor may also grow large enough to cause numbness or paralysis of the face. In rare cases, the tumor may grow large enough to press on the brain or brain stem. This can be life-threatening. Causes of acoustic neuroma. An acoustic neuroma is caused by an overproduction of Schwann cells. Schwann cells are a type of cell that normally wrap around nerve fibers to help support and protect nerves. The overproduction of Schwann cells is caused by a defective gene. Genes tell the body to make certain substances. Every person has thousands of genes. Our genes make us look the way we do. They also have a lot to do with our health. Genes are found on chromosomes. Each person has 23 pairs of chromosomes. The gene linked to acoustic neuroma is on chromosome 22. Normally, this gene produces a protein that controls the growth of Schwann cells. When a gene is defective, it does not work correctly. An acoustic neuroma forms when the gene on chromosome 22 does not produce the protein to control Schwann cell growth. The Schwann cells grow too much, causing a tumor. If the tumors affect both hearing nerves, it is often because of a genetic disorder called neurofibromatosis. Neurofibromatosis mainly affects how nerve cells form and grow. It causes tumors to grow on nerves. You can get neurofibromatosis from your parents, or it can happen because of a change in your genes. Diagnosis. The symptoms of acoustic neuroma are similar to those of middle ear problems. This can make acoustic neuroma difficult to diagnose. Acoustic neuroma is also difficult to diagnose because the tumor grows slowly. It may not cause symptoms for a long time. Early symptoms may be mild. Sometimes an acoustic neuroma is found when performing tests for other ear conditions. Your healthcare provider will ask you about your family's medical history in addition to your own. He or she will also ask about your symptoms and perform a physical exam. A hearing test or audiometry can test your hearing ability. For this test, you will wear earphones. Sounds are directed into the earphones one ear at a time. A wide range of sounds and tones are used for this test. Another test used in diagnosing acoustic neuroma is a brainstem auditory evoked response, or BAER. Electrodes are placed on the scalp and ears for this test. The electrodes record your brain's responses to noises you hear through earphones. The BAER test measures how well your ears are communicating with your brain. An electronystagmography, or ENG, may also be done. This test measures your eye movements while stressing your balance. Often, abnormal eye movements are a sign of inner ear problems. Imaging tests are the best way to find an acoustic neuroma. Imaging tests that may be used include a CT scan or MRI of the head. Treatment. Treatment for acoustic neuroma depends on the patient's age, how large the tumor is, and if it is causing symptoms. Treatment may include watching and waiting, radiation, surgery. Some people may have a small acoustic neuroma that is not growing or growing very slowly. If it does not cause symptoms, your doctor may recommend watching and waiting. The tumor may not grow any bigger or ever cause symptoms. Watching and waiting is also common for older adults or people who are not good candidates for other treatments. It requires having regular imaging and hearing tests, often every 6 to 12 months. These tests will show if the tumor is growing. Radiation therapy may be used to stop the growth of an acoustic neuroma. It can also be used after surgery if part of the tumor could not be removed. Radiation may be done through stereotactic radiosurgery. Stereotactic radiosurgery allows a doctor to deliver radiation to the tumor without affecting surrounding brain tissue. Imaging scans are used to determine the tumor's exact location. Surgery may also be used to treat an acoustic neuroma. The goal of surgery is to remove the tumor. There are several different types of surgery that may be done. Often, the tumor is removed through the inner ear or an incision in the skull behind the ear, close to the ear canal. Like any surgery, there are risks involved. Talk to your healthcare provider about which treatment option is best for you.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Acoustic neuroma is a non-cancerous tumor that develops in the nerve that connects the ear to the brain. This nerve is called the eighth nerve, or the vestibulo-cochlear nerve. At first, you may have no symptoms or mild symptoms. The symptoms of acoustic neuroma are similar to those of middle ear problems. If the tumor grows large enough, it can press against the brain and become life-threatening. An acoustic neuroma is caused by an overproduction of Schwann cells. Schwann cells are a type of cell that normally wrap around nerve fibers to help support and protect nerves. An acoustic neuroma forms when the gene on chromosome 22 does not produce the protein to control Schwann cell growth. If the tumor stays small, you may only need to have it checked regularly. If you do need treatment, surgery and radiation are options.
Thank you for using Explain.